Bismillahirrahmanirrahim. Hello, everyone, and welcome to week 5 of MSK Unknown Case Series. This is a great case that we're about to see. The clinical history here was rule out fracture of right ankle pain. So the image that you're seeing is a lateral view of the right ankle. And if we take a look here, we can see that here is the tibia, the tibial plafond, the distal fibular tip. The tibia is articulating normally with the talus. Here is the calcaneus. This is the navicular. This is the cuboid. These are the cuneiform bones here, and these here are the 5 metatarsals. And to evaluate for subtle fractures, there are probably 4 really subtle, commonly missed fractures that we see on lateral radiography of the ankle, one of which is a posterior malleolar fracture, which would be right here. Here you can see that the posterior malleolus is intact. The anterior process of the calcaneus, which is right here, you can see that that's intact. The lateral process of the talus, which is this nice V structure right here, that's also intact. And then the base of the 5th metatarsal, which is very easy to see on a foot radiograph, but often can be missed on an ankle radiograph. The other 5th one that's commonly missed is actually better seen on an oblique view, which is a fracture of the lateral calcaneus where the extensor digitorum brevis tendon inserts. So those are the commonly missed fractures, and we don't see any of those fractures here. And at first glance, this may look like a normal X-ray of the right ankle. But if we take a further look here, we can see that in the posterior process of the calcaneus, or the calcaneal tuberosity, there's this serpiginous linear area of sclerosis here. And notice that this area of sclerosis is running perpendicular to the long axis of the calcaneus. The long axis of the calcaneus runs like this, and this serpiginous line is running perpendicular to that line. So this is an abnormal finding, a very abnormal finding. In fact, this is an example of what a calcaneal stress fracture would look like. And once you've seen one, you see them all, because this is exactly how all calcaneal stress fractures look like. They look like a linear area of sclerosis that run perpendicular to the long axis of the calcaneus. And notice that there's no break in the cortex. And often stress fractures don't necessarily have to have a break in the cortex. They can manifest as exactly like this, an area of microtrabecular sclerosis that runs perpendicular to the long axis of the bone. It can reflect as, focal cortical thickening. There are a lot of different imaging manifestations of calcaneal stress fracture. So this is something that I'd expect all residents to pick up if they're in the ED for a patient that's coming in for right ankle pain rule out fracture. Oftentimes these are young patients that are marathon runners, but it doesn't necessarily have to be a marathon runner, but this is a nice radiographic example of what a calcaneal stress fracture would look like. If we move to the MR, this is the MR on the exact same patient done 1 or 2 hours after the radiograph. And we can see how obvious the finding is here on MRI. You can see the dark hypointense line on this sagittal T2 fat sat weighted image through the ankle. Notice that the bone is dark here because we've satted out the fat within the bone, but you have this dark hypointense line which represents the fracture. And you have all this bone marrow edema around the calcaneus that's reactive from the fracture. And you have a little bit of retrocalcaneal bursitis. There's a bursa here that runs here, just superficial to the Achilles tendon, which is this dark linear structure right here that inserts onto the calcaneal tuberosity. But the findings are very dramatic and obvious on the MR because the MRI is very sensitive in evaluating bone marrow edema. So, while the finding may be very subtle on the X-ray, it becomes very obvious on the MRI. And this is just an axial image through the calcaneus, again, showing the fracture, again, is perpendicular to the long axis of the calcaneus. So, next time you see an area of linear sclerosis running along the calcaneal tuberosity or posteriorly, it runs perpendicular to the long axis of the calcaneus. It's nothing else but a stress fracture. Okay, and this is how all calcaneal stress fractures look like. So I hope that was beneficial. We'll do this again next week, another unknown MSK case. It'll be a very high yield case, and thank you for your attention. I look forward to seeing you guys next week.